Good afternoon, everyone. Happy Friday and happy November. I'm Lori Bumbaco. I'm the oncology dietitian here at Cancer Wellness Center. That's where I'm presenting from and where I work part-time and offer programs like this one. I also meet with individuals one-on-one, and I'm involved in a couple other groups at the center. And I love what I do. If you're interested in meeting with me one-on-one, please just reach out, and chances are you're eligible for individualized nutrition counseling. And this program is called Ask the Dietitian. It's one of my favorites. It's really a great opportunity for our participants to ask questions related to the topic that we choose, and it never fails. Our participants ask such amazing questions that really do challenge me, and it forces me to kind of go back to the research and go do some homework and make sure that I'm presenting the most up-to-date and accurate information. So for the month of November, I think we chose another popular topic. It's all about prebiotics and probiotics. I hope you agree. And so we had quite a good number of questions that were submitted. Now, what I'm going to do is share my screen and share my PowerPoint. There is a chance that I might not be able to get through all of the questions that were submitted today. And if that's the case, then we'll have part 2 for Ask the Dietitian for November. So we will kind of just wait and see how the presentation goes. If you registered for the program, you will have access to these slides. We send them to you. Also, I often like to include some recipes that are a way to sort of apply this information in very tasty and nutritious ways. And those recipes also go out to those who have registered for the program. So we do encourage as much as you can to try to register, because then you get the content. Besides seeing my face on this Friday afternoon, you get to also access the information, which is very important. So I'm going to get started, and without further ado, I'll share my screen, and we'll get going on Ask the Dietitian. Thank you so much for being here. And if you're joining us live on Facebook, welcome. I hope you're all having a wonderful Friday. So as I shared, November Ask the Dietitian is all about prebiotics and probiotics. One of my favorite topics besides oncology nutrition. I think it's a really fascinating area to learn more about. So on the agenda for the program, I'm going to get right into those questions. As I shared, there were over 15 that were submitted, and I'm going to try my best to answer those questions to the best of my abilities, and then offer some resources and recipes along the way. Okay, so those questions, let's list them. So I thought it would make the most sense to start here. What exactly is the difference between them, and why do they matter for health, right? So there were similar questions that I'm going to lump together as one. Can you get them solely from food, and what's the best source in food? So a lot of people had similar questions in mind. The third question, what are options for a diet that is free of dairy and gluten? If you're taking over-the-counter products such as Floristore, is that better than eating the food sources? Great questions. If you take only one, is a prebiotic better than a probiotic? Is there a preferred time of day to take either of them? Which are the best to take after a cancer diagnosis? I love that question, right? Because we want to make it relative to your particular situation. And what I'm going to do, as always in this program, is provide a general answer. So probably the best guidance would be to meet with me one-on-one so we can evaluate that question and I would like to give you a more tailored response to that. The second part of that question, these were also submitted that are sort of similar. Are some probiotics allowed while on treatment and not others? Why or why not? I have read recently that taking probiotic supplements may be the wrong choice because it may introduce the wrong bacteria into our systems. That was new to me. Have you heard that? And then also would love to hear about some prebiotic food recommendations. Are there specific guidelines for recommendations for those diagnosed with LPR? For example, kefir is all the rage, isn't it? But I'm unable to drink it. So bottom line, how can I improve my LPR using prebiotics and probiotics? What are the best ways to recover gut health after taking a week's worth of antibiotics like amoxicillin? What are the best ways to recover gut health after a colonoscopy? Are gut microbiome tests to know my unique probiotic needs reliable? Love that question. I'm so glad it was asked. I'm going to answer it hopefully today. or in part two. I heard that oral microbiome affects gut health. Can you share your thoughts on it and on taking a probiotic lozenge like BioGaia? All great questions. All right, let's get to those answers. So we'll start first with like defining both pre and probiotics. So prebiotics, they're sort of new to our family here. So prebiotics were first defined in 2016, not too long ago, by a panel, an expert panel, as a substrate that is selectively utilized by host microorganisms, conferring a health benefit. So I'm giving you all the very specific details. I'm going to help it make the most sense for you in just a few minutes. There's three essential parts to a prebiotic. It has to be a substance, it has to be physiologically beneficial, and it has to have a microbiota mediated mechanism. Okay. All this fancy talk just basically to say that they're the food for the microbes that live in and on us. And we have different microbiotas, communities in our gut is the largest. Our oral microbiome and microbiota community is the second largest. But we also have a microbiome in our lungs and also on our skin. And so we're learning a lot more about that. And if we have diversity of the beneficial microbes, this is thought to be a good thing. And those beneficial microbes need food. And if we give them good food, they're going to flourish and they're going to be active and they're going to we're going to coexist with them in ways that might benefit our health. So where we find prebiotics is that they both occur naturally or in synthesized form. So you might find some products, food products that have prebiotics that are added to them. This is what they do. I took this right from a really great consensus statement from the ISAPP, and I'm going to come back to how valuable that organization is for us, or association. Here are all the benefits to prebiotics. And you could see there's many. And if you even wanted to reference this for yourself, because I know some people I work with do that, you can look at the endpoints for each of the different prebiotics that are used. And you can see there's really quite a list, right? They are related to metabolic health. So whether it's helpful in managing overweight and obesity, type 2 diabetes, metabolic syndrome, a lot of GI health in terms of irritable bowel syndrome, but also inflammatory bowel disease, also for bowel regularity, traveler's diarrhea, constipation. The list goes on, and it seems like there's a lot of promise to these prebiotics. So stay tuned because we're going to talk a little bit more about that, but lots of health benefits here. Now we'll talk about probiotics. So they've been around for a little bit longer. They're older members of the family. They were defined in 2001 as live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. So that's the technical definition. We find probiotics in a lot of different foods and supplements, but really technically only the characterized strains that have been studied and that show a scientifically demonstrated effect on health are allowed to be called probiotics. They're known by their genus, their species, and their strain. So you see an example listed there. So the genus is Lactobacillus, the species is the Acidophilus, and strain is ABC, for example. The dose matters, but we don't want to necessarily assume that a higher dose means it has a greater benefit, right? So the amount matters, but the amount of dose doesn't necessarily need to be high for us to benefit from it. Now, the available evidence, and this is from decades of studies, so it seems to be confirmed here, that there's a lot of benefit to probiotics in specific GI conditions. So now you're asking, which ones? And I will share that with you in a moment. So how probiotics actually work, we don't really know, and it's still an active area of research. They think that the mechanisms of action for probiotics are too challenging for us to understand in terms of a scientific research study. And so even though things are happening, there's a benefit that is the outcome. And so I think that's maybe it's just a matter of time before we learn more about that, or maybe we don't even need to know. If we see that if we take a specific probiotic and we get a health benefit from that, that's good enough, right? Experts suspect that there's multiple mechanisms at play, and that's part of the challenge in knowing how they're operating, right? A common misconception is that probiotics need to alter our own gut microbiota in order to be effective. And in fact, that's not the case. So in general, probiotics they haven't been shown to take up permanent residence in the gut, despite their benefits. So they're introduced to our gut and they probably are working somehow in some way, and we're getting a benefit from them, but it's not like it's changing our gut microbiota in any way. Really interesting. So I promised I'd come back to this. What is the strongest level of evidence for probiotics? It's really in our digestive conditions that you see listed here. So for inflammatory bowel disease, for IBS, for antibiotic-associated diarrhea, for some of our infectious diarrheas, traveler's diarrhea, constipation. It can be an adjunct to the standard therapy used for H. pylori. And then there's some emerging evidence that probiotics are beneficial for obesity and satiety, and even some of our mood disorders. So which probiotic to take matters depending on what you need it for, right? We don't just take a random probiotic and assume it's going to help our constipation. We need to know specifically, and I'm going to give you that information. It's towards the very end, but this is where your healthcare provider can really help direct you in the right way in terms of choosing the right probiotic for your specific unique needs. Here's some key takeaways. Nice little summary chart of pre and probiotics. So prebiotics are basically parts of food. They tend to mostly be fibers. We don't digest them, but they are a source of food and fuel for the beneficial microbes. They are naturally found in foods like asparagus, onions, and garlic, but then they're also added to functional foods. And they benefit us in a way in terms of helping our beneficial microbes flourish. And so if we're giving our beneficial microbes, which perform a lot of different actions, if we're giving them good fuel, they're going to do their job in the best way possible. Now, probiotics, on the other hand, those are actually living organisms, and they have been shown directly to provide a health benefit. We do find them naturally in food forms, such as fermented dairy, even cultured non-dairy products as well, and also some of our fresh fermented vegetables like kimchi and sauerkraut. Delicious. But we also see probiotics in the supplemental form. If we're going to benefit from probiotics in terms of those conditions that I listed on the last slide, we probably need to take a probiotic. We're probably not going to benefit from taking it in food. Okay, on to the next one. So good segue here. So can you get probiotics solely from food, and prebiotics as well? Yes, prebiotics, as I just shared, most of them are dietary fibers. But it's important to know that not all fibers are prebiotics. So they're really kind of special, right? They're in a category all of them in their own. So oligofructose and inulin are really the most commonly known and the most well studied at this point in time. And where we find these two prebiotics are in onion, garlic, Jerusalem artichokes, dandelion greens, yum yum, and asparagus. Sometimes they're added to foods, so you might see prebiotics added to cereals or breads, cookies, a lot of baby and infant products, because the thought is that it's going to help them through early stages of life, which is really fascinating to me as well. I misspelled desserts, but desserts as well. And then even some functional drinks have some prebiotics added to them. Experts recommend about 3 to 5 grams of prebiotics per day. That's a good recommendation because most Americans are not eating recommended amounts of fiber. So just focusing on eating some sources of prebiotics are going to automatically add more dietary fiber, which is beneficial for a lot of different reasons. Not only just the prebiotic benefit, but the foods that tend to have these prebiotic fibers also have a lot of really other healthy things. So I love this recommendation. Some argue that it's difficult to achieve that naturally through food sources. I do think it can be done. I do think it may take time, but for some of us who are eating not a lot to begin with, we may want to explore some functional foods that might be recommended in order to help us achieve that goal. So what are those foods? So we're going to look on labels because there's so many to list. I couldn't even possibly do that for you. I have a couple examples to give in a minute. But if we look on labels and we look under the ingredients, if we see one of these words, it's a source of prebiotics. So inulin, as I shared, that's one of the most popular ones. Wheat dextrin, acacia gum, psyllium, and polydextrose. And then there's our OSs, so GOS, FOS, and TOS. I'm not going to even pronounce the full name. We're going to just keep with the acronym there. They're also popular and commonly used in food products. So here's two examples here. And I think the market is about to explode with these types of products. And it's exciting. I think that maybe if there are more studies done in terms of the specific benefits for unique conditions in which some of these prebiotics can be added to the diet, there might be some good choices here. However, I will say that just because a food has a prebiotic in it, it doesn't render it necessarily a great choice for you, right? There might be some trade-offs. Maybe some of the prebiotic functional foods have extra salt or have extra sugars added to it. But if the functional benefit is one that might be beneficial for you, it could fit, right, in an overall healthy diet. But again, don't just necessarily assume that a food that has prebiotics is automatically a health. It could be a health halo, right, where it makes it sound healthier than the food actually is. So we want to scrutinize those labels even further, and that's where a dietitian can help. So what about probiotics? So we already sort of listed this. So fermented foods most often contain probiotics, and that's because the microbes, again, in sufficient amounts, were used to ferment the products. So yogurt, kefir, kombucha, kimchi, sauerkraut, especially if it's fresh. But sometimes those food products may not meet the required level of evidence to be classified as a probiotic, right? Because if you remember that specific definition, it is very specific. It's a certain strain in a certain amount directly feeding or directly targeting the microbiome. So that doesn't always necessarily, we don't have a guarantee with that, with our food sources of probiotics. Sometimes fermented foods have a mixture of uncharacterized microbes. There's so many, right? So we don't know what they're all doing. So we actually don't know if any of those uncharacterized microbes are giving us any benefit. If a fermented food has undergone processing, such as pasteurization, baking, smoking, or filtering, it also will render the probiotic less active, or even it might not be viable by the time it reaches our gut. So it makes it a little kind of confusing, and I don't want to overwhelm you with all this extra information, but just realize that I think if you're someone who has a specific condition where there is evidence that a probiotic may help, then yes, it might make sense to take a probiotic supplement. However, if you're someone who is just looking for overall general gut health, just be confident that eating some fermented foods are going to deliver you some probiotics. And cultures that eat that way, that have some of these fermented foods in their diet, they tend to have some overall great gut diversity in terms of the microbiota. So that's sort of the best we can do. And I know it's a little bit of a gray area, but I think it's as helpful as information as I can give you. So the bottom line about some food sources. So food sources provide our body and certainly our digestive tract with both pre and probiotics to support our health. But the food sources that have pre and probiotics also have a lot of other nutrients, right? Whether they're macro or micronutrients, they might also have antioxidants and phytochemicals. And a lot of those foods also so happen to be cancer protective. And I've shown some images on the slide here, like apples and garlic and the asparagus. We know there's other compounds present in those foods that are beneficial for us. So we're really reaping the benefit and maximizing the cancer protective properties when we eat this way. The decision to take a specific probiotic supplement or one of those functional foods that have prebiotics added to it, that's really going to depend on your specific need. Right. So if you have a specific condition of concern, food might not give you that guarantee. But the probiotics that have evidence to support their use, that's where we want to really think carefully. All right, next question. What are the options for a diet that is free of dairy and gluten? So, non-dairy products that are fermented, for example, like non-dairy yogurts, they could be a source of probiotics, right? But what I need you to do is check your labels, right? So here's an example. This is like an almond yogurt. So what I see on there are a couple other ingredients, but especially I see live active cultures. So those live active cultures are sort of like a guarantee that this product has in it those additional probiotics. So it's a food source. Yay. All right. Not all companies will disclose this information. Sometimes they just say live active culture, so we don't really know which strains or types of probiotics or microbes they're using. So I would say just kind of get familiar with your products that you're eating already. Maybe take another look when you go to the grocery store to see are there other options. Because I think as it relates to eating both pre and probiotics, we want to think diversity. Diversity really does seem to be key. So if we're getting like a broad spectrum amount of different types of microbes because we're eating different products that deliver different microbes and then eating different foods that give us different types of prebiotics, we're really maximizing the potential in terms of how they all work together and give us really this synergy in terms of supporting our health. Now, food sources of prebiotics, they tend to, they're naturally, I couldn't think of any, they're naturally gluten and dairy free, right? From the ones that I listed. So we don't have to worry about prebiotics. Now, if you are dairy free, I think you want to, it depends on why you're dairy free. If you're dairy free because of the lactose, most probiotic supplements are lactose free. But in the end, I think I need you to just check labels on products if you're thinking about taking one, whether or not there's a source of gluten or dairy on the product. All right, moving on. Is taking over-the-counter products like Floristore, is that better than eating the food sources? I like this question a lot too. So a little bit more about Floristore. It contains Saccharomyces boulardii, and that specific, you see that's a very specific strain there. There's all those different numbers and letters. And Floristore does have evidence. So there's some research studies and good solid studies that have shown that Floristore is helpful for antibiotic-associated diarrhea, for C. diff, that's a type of infection-associated diarrhea, for that H. pylori as an adjunct to this treatment that's standardly given for H. pylori. It's also helpful for traveler's diarrhea, as well as inflammatory bowel disease, so especially ulcerative colitis, so as an adjunct to standard therapy. The evidence is less strong, but the evidence is still there, and maybe it's a matter of time before the evidence shakes out. Will it strengthen the evidence to recommend Floristore for ulcerative colitis, or will it lessen? You know, it's just a matter of time. But if those are any of the conditions you have, then this would argue the use of Floristore, right? Because that's what the evidence shows. Otherwise, I don't know if you need to take Floristore, right? That's how we make our decisions about probiotics. This is a really good example of how probiotics are defined and used. The strain is a very specific strain. The dose is high enough or actually where it needs to be in order to offer the benefit, right? So I don't know that we can find that specific strain in a food, and I don't know if we know it's going to give us enough of what we need, right? So the only guarantee in terms of those conditions that I listed on the last slide, would the Floristore make sense? Okay, otherwise with food, you're sort of kind of just gambling whether or not you're taking enough of that strain. And I think it's a good argument for why a probiotic could be recommended for somebody, right? It's a very specific product and it's specifically used in those conditions that I just listed. I think that's probably the most important question in today's Ask the Dietitian. It really helps demonstrate what probiotics are used for. Okay, so if you only take one, a prebiotic or a probiotic, which one's better? Is there a preferred time of day to take either? Great questions. So remember the definition here. Probiotics are live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. We benefit from them if we need them in the first place, right? So if we have IBS or if we have constipation, I mean, the list goes on and on, antibiotic-associated diarrhea, then we want to probably take a probiotic, right? Again, you're going to check with your healthcare provider to see if that makes sense. you certainly could eat food sources of probiotics, but you may not get the benefit of those very specific conditions, right? And with prebiotics, we know this now. I don't have the specific definition listed, but prebiotics are the food sources for beneficial microbes. And I would say, even though there's no guidelines for this, that we all would benefit from eating more prebiotics, right? Because we have a natural microbiota that's already present. It does get affected by things, which we're going to talk about in the next few questions, but really want to reinforce the activity of those beneficial microbes and help them flourish, help them replicate. And the way to do that is through food, right? So eating the prebiotics would benefit us regardless. So how do we maintain a healthy gut microbiota? Well, so if we think about prebiotics, they're sort of like the fertilizer for our beneficial microbes, and they're going to promote their growth. And a really great research study, I'm going to offer a resource at the end of the presentation for how to do this, but a research study pointed out that if we have 30 different types of plant foods per week, then that is associated with increasing the diversity of the beneficial microbes that are in our gut. So there's something to that, right? Different diverse food choices. So 30 different ones in a week. It's not always easy to do, but I think it's possible. And remember, herbs and spices count too. So we really could add up in some really delicious foods and recipes. We can add up those numbers and accomplish that goal of 30. But it seems like doing that may help improve gut diversity in terms of the microbiota. Now, probiotics, they seed our gut with well-defined good microbes, right? The ones that benefit our health. So including a variety of fermented foods with live active cultures daily, especially from either dairy or non-dairy alternatives. They're a great way to think about how to really maximize the function of your gut and the beneficial microbes that live there. So now how do we take them? That was part of the question, right? One study suggested that probiotics survive better when we take them with a meal or 30 minutes before a meal. So there's something to that timing, as it seems. Non-enteric coated probiotics should be taken with or just prior to a meal, and also containing some fats, right? That's going to help best digest and absorb those probiotics. If you take a prebiotic and a probiotic together, this is an okay thing. Sometimes there's been a little bit of research that they act together, and they call that symbiotic, and which is really cute. And so the thought is that they will work best if they're used together. So there's ways to do that as well. And one of the recipes that I've included is an example of doing that. It's a symbiotic. Really cool. All right, next question. What are the best ones to take after a cancer diagnosis? Are some probiotics allowed while on treatment and others and not others? Why is that? So there's no available evidence at this point in time to recommend a probiotic after you've been diagnosed. It's not like a standard of care. Like we can't just say, oh, you've been diagnosed, take probiotics, right? We just don't have that information yet. So the decision to take one may depend on your need, and certainly where I work in clinical practice, this is on my mind, so when I'm working with someone and developing a very specific nutrition care plan, I do take this into consideration. Would probiotics benefit this person based on the following information? So probiotics have been shown to help control some of our symptoms associated with treatment. So it might be chemo or radiation induced diarrhea, and also promoting recovery of our GI function if we've had surgery to our digestive tract because of our cancer. There's a little bit of research that probiotics may prevent, and I think that's a strong word. I would say maybe associated with reduced risk for chemo-related cognitive impairment in those with breast cancer. There's a little bit of information that it may decrease the severity of chemo and radiotherapy-induced oral mucositis in nasopharyngeal, as well as head and neck cancers. Interesting, right? And some strains are suggested to modulate immune function and improve response to immunotherapy. It's too soon to tell about that, and I'm going to talk about that more in a few minutes. So despite the promise of probiotics, again, overall evidence to support their use is limited. There is so much heterogeneity in research, especially nutrition research. So we don't really know specifically who should take what and at what dose. So many studies use different strains, they use different cancer types, they use different cancer treatments. Like there's no good like summary of available evidence that we have at this point in time. So I think it's just a matter of time before we know more. Also of the research that it has been conducted, it's a very small sample size. So that really makes us less confident that any outcome is as strong as it might be. And just FYI, I think in terms of anyone considering probiotics, we have a varied response to it. So sometimes we see that people do not get any kind of gut colonization if they're taking probiotics. So again, we're not replacing the microbiota that someone has, but sometimes these probiotics taken in a supplemental form just don't do anything for people. Like they just kind of pass right through. So they're not active, they're not beneficial. Very, very fascinating to me. I think it speaks to how unique we all are. But we also don't have any sort of practical way of determining who these people are that don't have a response at the moment. So again, we have to just wait and see. Early available data suggests that indiscriminate use of probiotics may be harmful in the setting of someone taking an immune checkpoint inhibitor. So if that is your cancer therapy, you need to be aware of that. And I would recommend you avoid probiotics in that case. So the bottom line on probiotics in cancer, individuals who are immunocompromised or have a central venous catheter should not take probiotics containing S. boulardii. That's because there was some research that it caused some septicemia and bacteremia. And so anyone who is significantly immunocompromised, I'm going to talk about that in a minute too, should not be taking that type of probiotic. Now, even the non-pathogenic strains could, in theory, cause an infection for someone who's immunocompromised because there's an altered immune response. If someone's significantly immunocompromised, I'm going to detail that a little bit more in a minute. But the intestinal barrier is compromised, the immune response is compromised, and so these non-pathogenic strains end up being recognized as something that could be pathogenic. So we want to be very cautious at this point in time with just necessarily taking probiotics. Food forms are okay, as it turns out, but we don't want to take a very high dose of any type of probiotic. So what I want you to do is speak with your care team before you're thinking about taking a probiotic, especially if you have a weakened immune system, especially after cancer treatment or during cancer treatment. For most individuals on treatment, eating food sources of probiotics are safe and do not need to be limited. But if you have any concerns about that, you don't feel comfortable doing that, just discuss that with your care team, okay? And of course, you could work with an oncology dietitian who will guide you appropriately. We might get through all these questions today. All right, I have read recently that taking probiotic supplements may be the wrong choice. So this is sort of a nice segue that coincides with the last question, right? So safety of probiotics, I have heard that there are some gaps, and I think that that's why there's some hesitation to recommend them, right? Because we don't have a guarantee of their safety. We do know that it may cause harm in specific populations. So for someone who is severely immunocompromised, that's probably someone who is in the hospital or who just had a stem cell transplant. That's how we would really define immunocompromised, severe immunocompromised. But if you have any question about that, you just need to ask your care team. Am I severely immunocompromised where I need to worry about probiotics? But also in preterm infants, there's been some case reports of some really concerning problems. So, and more along those lines, there have been 60 case reports since 1966, which really isn't a lot, but it's enough for us to, again, pause and be concerned. So what happened is that using that Saccharomyces led to fungemia. And they were able to kind of really trace it back and find out that that was the source of the problem from the probiotic. Of these 60 case reports, most of them happen to be in the ICU. So again, they're significantly compromised, right? They were receiving a tube feeding or TPN. They had a central venous catheter. or they had received broad spectrum antimicrobial treatment. So probably all of these things combined really significantly compromised the body's response to the probiotic, and it wasn't able to respond in the way that it typically can if we don't have these things happening in our life, right? So just to kind of paint a picture of who we absolutely recommend not taking a probiotic to. So the World Gastroenterology Organization recommends only using probiotic strains that have proven efficacy. And I think that that makes sense, right? If you don't fall under the criteria of being a preterm infant or have severe immunocompromise, experts do not have any recommendations otherwise. So they can't say for or against their use because, again, we just don't have that data. We don't really know. The decision to take one can be based on whether or not you have a specific condition that probiotics have been shown to alleviate symptoms. So I would say a good rule of thumb is if you have immunocompromised, if you're on treatment or just recovering from treatment, talk to your care team. And if you have a desire to take a probiotic for any reason, you can explore that. What is your reason for it? What's the why behind it? Do you have IBS? Are you worried about gut health and you just want to restore your gut health? Because there might be a lot of other considerations to make, and the timing, all of that might matter. Okay. So you can, though, benefit from eating a diverse diet and one that's high in a lot of plant foods. We know that that's going to be great for the gut, including some fermented and cultured products also, including them regularly. This can support a diverse and well-functioning microbiome. And we know that that's also safe. Are there specific guidelines for someone who's been diagnosed with LPR? Can I improve it with prebiotics? Kefir is all the rage, right? So LPR is laryngopharyngeal reflux for those of you who are not aware, and it's the backward movement of stomach enzymes and acids into the lower throat region. So the way someone presents is with symptoms of excessive throat clearing, persistent dry cough, sore throats that are not associated with a cold, hoarseness, or the feeling of a lump in the throat. My understanding is that the standard of care for LPR is a three-pronged approach. So there's attention to the diet, attention to behavior changes in terms of eating, and then use of acid blocking medications. So those medications typically include PPIs, antacids, and sometimes H2 blockers are used. The behavior changes are to think about how to help minimize that backward movement, right, of those acids and those enzymes. So we let gravity do its work, right? And we stay upright. We avoid exercising right after eating because that's going to really kind of stir things up. We try not to lay down. It's going to cause some of that reflux. And smaller meals tend to have less production of enzymes and acids, so they're going to have less of a risk of any backward movement of it. Now, the diet choices, so typically we recommend, and this is very generalized, no caffeine, alcohol, chocolates, or peppermints. What happens is that weakens the lower esophageal sphincter. So this is also helpful for someone with GERD. That normally would hold the stomach contents where they belong, right? But if those foods, and again, you want to know specifically if these foods are a problem for you or not. You might be fine with having some chocolate, right? Or some chocolate peppermint. The two together sound delicious, but the two together might be a problem. So knowing for you what might weaken that lower esophageal sphincter in terms of the pressure, and tolerating what amount of each of these, if at all. Citrus fruits, kiwi, pineapples, tomatoes, other acidic foods, they tend to irritate the throat. And even if you're on a prescription and you feel like it's working well, some of those foods can still cause some direct irritation potentially and inflammation. Carbonated beverages can also bring acidic contents into the throat. So we want to be aware of that as well, even in non-caffeinated soda. What about probiotics? Well, unfortunately, we don't have any available evidence, so I can't make a recommendation. So think about a holistic approach. Could you include both pre and probiotics in your diet? The onion and the garlic family, asparagus, banana, oats, all those fermented foods that were listed earlier. Thinking about plant diversity, right? Because that's going to give your gut microbes and even the oral microbiota the beneficial fuel in order for them to flourish. Of note, I just want to mention this, if you're on a PPI long-term, you may want to discuss with your healthcare team whether or not you need a vitamin B12 supplement. As it turns out, PPIs, obviously they lower the acidity of the stomach, and so B12 requires that acid in order to be cleaved so that we can absorb it lower in the digestive tract. So if that isn't being cleaved properly because there's not a lot of acid for it to be cleaved in the stomach, someone could develop a B12 deficiency over time. I'm going to answer one more question, I think. Yeah, I don't think we're going to get through this. So, and then we'll have a part 2 for this. So, what are the best ways to recover gut health after taking a week's worth of antibiotics? So, a short course of antibiotics, and certainly a week, constitutes that. It disrupts the gut bacterial community and it kills many important resident bacteria. Overall, there's a reduction in microbiota diversity as well. Once we stop taking our antibiotic, the diversity will increase. It may take time. It may take up to a month. And the operative word here is that it almost returns to the starting composition. So sometimes it never fully recovers. So some bacterial species are very sensitive to these antibiotics and are never able to recover and really get back to what they originally were doing and existing in terms of our microbiota. So also of note, levels of antibiotic resistance among bacteria may also increase. Fascinating, right? So amoxicillin may result in GI side effects like diarrhea. Discuss with your prescribing provider whether or not a probiotic is recommended for you. Some of the probiotics recommended for antibiotic-associated diarrhea are BioK, Culturelle, Florastor, Shift Digestive Advantage, and Ultraflora. That has the strongest level of evidence. If you are on an antibiotic and you're experiencing diarrhea, these probiotics, will be helpful in minimizing the severity of that. So whether or not you're advised to take a probiotic, consider how you could include both sources of pre and probiotics in your food supply and think about diversity, right? So I mentioned I would come back to this. Diversity matters. If we eat 30 different plant foods in a week, it's going to support gut microbial diversity. And there's a great book. I recommend it all the time. Dr. Megan Rossi is the author. She's a dietitian. And she's also a PhD dietitian. She's done a lot of research in terms of gut health. And so sometimes people that might not have a specific condition or have been on antibiotics or have been on treatment that rendered their gut a little less than normal, I recommend this book because it's a great way to incorporate a variety of different plant foods and also some cultured foods and some fermented foods so that you can kind of get back to this diverse gut microbiota that experts think is so beneficial for us. So tossing this one out for you all because we're going to have to end early. This is a great resource if you're curious to learn more. So because of the time, I'm going to stop my share here and see if we have any other questions or comments.